Okay friends, let's begin some points in psychiatry and some question too. A 70-year-old female misplaces her spectacles here and there. Now she is shouting on children. This happens frequently in her life. So what is this condition? This is one of the feature of a patient having dementia. Okay. And this is the catastrophic reaction of dementia. Next one, 70-year female is having decreased concentration, increased forgetfulness, sluggish gait, and frequently falls. She is complaining of seeing red animals, but that is actually not present. So this is visual hallucinations. So one complaint is visual hallucinations. So this is the dementia with Lewy body. Dementia with Lewy body. She can see the somebody. She can see somebody which is actually not present. Here is body. This is the mnemonic. So visual hallucination is one of a striking feature of dementia with Lewy body. Next questions. Okay. 60-year male patient. He has now strange behavior, inappropriate sexual remark, and he is toileting in public place without any shy, and he is laughing at a funeral. So this is what? This is frontotemporal dementia. Frontotemporal dementia. Here patient is not shying. Patient is not shying. So shyness is related to frontal lobe. Shyness is related to frontal lobe. And abnormal sexual behavior. This is sexuality. This is in temporal lobe. So this is the character of FTD, frontotemporal dementia. Next question. What nucleotide expansion is seen in FTD? What nucleotide? So this is the hexanucleotide expansion. Hexanucleotide expansion. So how can we remember? So in previous question we have seen something sexuality problem. Okay, it has S6, hexa is 6. Okay, so hexanucleotide expansion in FTD is the problem. And what are the gene mutation that's seen in FTD? It is C9 or F72. C9 or F72. This is the single term, or C9 or F72. This is located on chromosome 9. Progranulin, this on chromosome 17. And mapped, this is microtubule associated protein, tau protein, on chromosome 17. So these three genes have to be remembered for FTD, hexanucleotide expansion. Next one, what is this? Dawn, of course. This is his Dawn, and this is girl. Okay, Ravina. Okay, so what is the mnemonic in this picture? So Dawn, girl, Ravina. Okay, so this is the, so this old Buddha turkey has Alzheimer disease, and to treat this condition, Dawn, girl, Ravina is there. So Dawn is donepezil. Girl is galantamine or min. Ravina is rivastigmine, rivastigmine, rivastigmine. So I think this mnemonic is helpful. Okay. So what all these three drugs are doing? These drugs are anticholinesterase inhibitor, anticholinesterase inhibitor. So whatever cholinergic neuron is saved, whatever cholinergic neuron is there in brain and that is functioning and forming acetylcholine, that acetylcholine should not be broken down. अच्छा ही दिमाग में जो थोड़ा बहुत अच्छा है डॉन का, that should not be disturbed. That's why donepezil, galantamine, rivastigmine has got role. But among these drug, donepezil, this drug can be used in all stage of Alzheimer disease. These drugs are these drugs are anticholinesterase inhibitor. Sorry for little correction. This should be acetylcholinesterase inhibitor. Sorry for correction. Okay, but mnemonic is okay, good. Next one is Alzheimer disease. It can be early onset and late onset. Early onset and late onset. Early onset, अगर आपके पास ऐसे patient है that is having that has been diagnosed as early onset Alzheimer disease, आपकी परेशानी बढ़ गई है. So आप परेशानी 1, परेशानी 2. So what is APP? Amyloid precursor protein, chromosome 21. Presenilin, presenilin 1, chromosome number 14, and presenilin 2, chromosome number 1. Late onset is ApoE4, that is on chromosome 19, and TREM2 on chromosome 6. Next one, cortical dementia. Cortical dementia on the location in brain is divided two type of dementia. One is the cortical dementia, another one is subcortical dementia. Subcortical dementia. Okay, so we will see few disease of cortical dementia. This is Alzheimer disease, FTD, and Creutzfeldt-Jakob disease. Next one, Adams-Tried or Hakim-Tried. Adams-Tried or Hakim-Tried. So patient is having urinary incontinence, dementia, and gait disturbance. These tried make Hakim-Tried or Adams-Tried. Next one, what is the difference between dementia and delirium? Dementia, it's old onset actually, usually, so this is seen in elderly patient. Delirium can be seen in children as well as elderly one. Dementia, loss of memory and intellectual abilities are seen, but in delirium altered consciousness is seen. Altered consciousness in delirium. Next and the last one for today's topic. Okay, this photo, this picture, histology, neurofibrillary tangles. What is this? This is neurofibrillary tangles. This is inside cytoplasm of a neuron. This is inside, in which disease? Alzheimer disease. And what protein is here inside? Phosphorylated tau protein is seen. So thank you friend, like and subscribe my channel.